Hello everyone, welcome a new life from Medcare. Today we're going to talk about how to prepare children for return to school. Firstly, let me give you a brief about myself. My name is Michael Atiyah. I am a specialist pediatrician with subspecialty in neonates. I'm working in Medcare Rashidiyya Clinic. Actually, I have more than 14 years experience in the field. I had worked at the military hospital as well as teaching hospitals and other private hospitals in Egypt. And now I am honored to be one of Medcare team. Now let's start our life. Definitely, there will be challenges that children are likely to face with return to school. After a long period of time at home during lockdown, there is much to readjust in the lives of the little ones. Then, how to more about returning to school. So sit and talk to your child, ask questions about how they feel, listen carefully and give them child words and phrases to express their feelings in case they struggle to express their feelings. Like, are you sad? Are you afraid? Show them that you understand what they feel. Make yourself available as much as possible. They may want to come and debrief, but maybe not when you expect. Create space for talking in different ways, such as going on a walk together or baking together. There may be less pressure in these circumstances than when sitting and talk face to face. And now let me tell you three important instructions and three important questions. Regarding the instructions to teach our children to wear their masks, keep social distance, and wash their hands. Again, keep the social distance, wear the mask, and wash your hands. And regarding the three questions, first question is how to prepare children to the fact they need to wear the mask. Second question is how to prepare children to use the washing room eating in the school. First of all, let's talk about how could parents prepare their children to wear the mask. Most of kids cannot feel comfortable seeing people in masks actually. And it can be strange for them or a little bit scary sometimes. So parents need to do the following to make it more comfy for the children. So help kids get used to masks and give them time to practice questions and encourage your kids to decorate their masks with markers or stickers. This will give them the feeling of ownership. Give support and let them wear face shields during. Should encourage their kids to take precautions while using the school washing rooms. They should advise them to stick to the number allowed in the washing room, not to remove their masks, not to touch their faces, wash their hands with soap for at least 20 seconds, use paper towels to open and close the doors, not to touch any surfaces, use paper towels to dry. Thirdly, how to eat safely at school. Actually, all families are encouraged to support food and drinks for their children, along with their own plastic safe utensils. Hand wash before eating is very important. Also, you can encourage your kids not to share foods with others. And also, you can encourage the use of sanitized water during the meal breaks when masks need to be temporarily removed. In addition, there is another challenge as the little ones lost the structure and the regular rhythm of the day, and that leads to the feeling of anxiety. When they start the new routine with the school opening. So we need to rebuild up again some routine like the sleep routine. As routine provides structure and stability during time of uncertainty, so help your child return to their normal sleep routine in the days before the school starts again. Also, parents need to talk about school. It doesn't have to start as a conversation about worries, but this might arise during your conversation with your kids. In addition, look at the positives. As school reopens, it might be helpful to talk about things which the child is looking forward to. For instance, they can go to their favorite shops, they can go to their favorite restaurants, they're gonna meet their friends. And finally, you can ask for help and consult a specialist in if back to school seriously affect your child mentally or physically. And finally, don't forget to teach your child, and may God bless you all and all your kids stay safe. Thank you. And now with Dean, we to answer some of your questions.
Thank you, Doctor, for joining us live today.
Thank you, Dean.
Yeah, you have covered most of the important topics that the parents should know. That now that the schools have started,
Sure.
some of the parents have already sent their kids to the school. So I'll just read out to you that I've got some questions on Instagram over here. So I'll just read out the first question.
Okay.
So this is your personal opinion. Now the cases of COVID-19, the cases are actually rising. So personally, do you recommend that parents should send their kids to school?
Actually, once we take the precautions, so there is no fears. Okay, but we cannot push parents to do certain thing, or to push them to be aligned with certain opinion. If they find that they will feel comfy with learning online, so they can take this decision. If they find it's better to go for face to face, so they take the precaution as we said, and it will be everyone take face to face. You just take the precaution as we said.
Okay. Doctor, like as you have mentioned, previously when kids were at home, they used to learn via webinar, and now they have to go back to school. Even the sleep habits, the eating habits, they have changed, right?
Sure.
So, what is the impact on their mental health now? I mean, what should the parents teach their children?
Yeah. Actually, as you said, there was impact during the last period.
Correct.
Even I had some complaints from mothers. They told me that the kids started to refuse to go out. They started to
that's right.
stay with their mobiles or tablets. So this was normal. Was impact due the last period. So we need to, as we said, we need to rebuild the routine. We rebuild the routine that was before. So we can start with the sleep routine. For example, we start to sleep at certain hour and wake up at certain hour, and we start to eat at certain time. So when we start with routine, then we will recover again what happened in the previous period.
Correct. So, doctor, when you speak about routine, like previously, the kids, I mean, parents to keep their kids at home because the COVID-19, they were not sent out, to maintain
Yeah.
social activities outside. So, is it okay? Is it allowed? Can the teacher send the kids outside? Whether they have to wear the mask during that time?
So there will be no problem. Just I'm quite sure that all the schools and the teachers will put their eyes on the children, and they will teach them how to take the precautions. They will keep the social distance. They will teach them more and more how to wear the mask and what is the importance of wearing mask, and it should not to remove the mask. So I'm trusting all the teachers and the school, they will take the right measures.
Yeah, and also sanitizing their hands and
Exactly,
everything.
sure, sure.
So on that note, doctor, sometimes I had actually personally read an article that over sanitizing your hands can cause some disease to the skin, like over sanitizing. Because parents have taught their children to sanitize their hands, but sometimes they're kids, right?
Yeah.
So they sanitize their hands a lot. So does it have an impact on their skin, on their hands, or is it okay?
Uh, Actually, if over usage of or over consumption of anything will have an impact. Okay, so sanitizing the hands just when they go new place and they open a door or they touch its surface or something like that. But if they stayed in the class, for example, like 1 hour, so they no need
No
to
need to
go to
sanitize,
make
yes.
hand sanitized.
Correct. So, doctor, one more question which I'll just read out to you. So, some kids sanitize their masks and they wear it. They sanitize their mask and sometimes the sanitizer tends to stick on their mask and they wear it on their face. So, will it affect their mouth or?
Alcohol make dryness. Okay, sure,
Okay.
they will not drink it because it's very hazardous. Okay,
Yes,
but
definitely.
when the alcohol touch anything, it make it dry. This is why it's not good to get the alcohol with 70% concentration to get near the mouth or the lips or the skin of the face, because it's volatile. It may come to the eye. So just for the hand, alcohol or sanitizers are just for the hands.
Okay. Um Doctor, is there a limit of the number of students that have to be sitting in a class at a time?
Actually, I read for the in the regulations of KHDA
Okay.
that there is something will be called like stable classes. Stable classes mean that every class will have like around 10 pupils. Okay, and there will be no changing in these 10 pupils. That will be more easier if someone or there is kids with any problem to track the other kids. So I think 10 will be very good,
Okay.
and even regarding to the place of the class, this will allow to make social distance and will be very good to prevent any spread of infections.
Okay, so the kids have to still wear their mask throughout, right? Even when they're in class.
Yeah, this
The
is
whole
mandatory.
day.
This is the
Yeah,
regulations.
it's a
Yes, yes.
regulation. Okay. So, doctor, what do you recommend? At what age should the parents send their child to the school? Like, say, for example, there are parents who think that their child are too young. Even if they teach them to follow the rules, like wear the mask, sanitize, and but they will not follow it. So, what do you recommend? Like, what age should parents send the child to school?
Uh, to say any specific age, it should based on study. Okay,
Okay.
but in this case, it's like experience. Everyone know his child what he can do, but all the time parents don't expect that much from children, but children actually surprise us. The children know what to do. If you tell them you need to follow this instruction, they will follow
Correct.
the
That's
instruction.
right. Yeah.
So don't underestimate the kids.
Correct.
They will do what's needed. But sure, if like 3 or 4 years and you teach them how to wear mask and how to wash your hands, and if you send them to the school, there will be a teacher that will observe them and will help them. So not I recommend parents not to be in this panic. Just take the side you make you feel more comfy. If you feel that you will be so worried if you send them to the school, so take the online
On the
yeah,
webinar.
choice.
Yeah.
Yes, yes.
Correct. So, doctor, is it okay for the kids to take the flu shot during this COVID situation?
To take,
Or the flu shots, the normal flu
sure, yes,
vaccination, or
yes,
is
yes.
it?
The flu shots will not prevent corona,
Hmm.
okay? But it prevent the symptom, because symptoms of corona are like or near to symptoms of flu. So to take the flu shot will
Okay.
yeah, will prevent, or to much extent will prevent the symptom of flu. So that will help, sure.
Okay. So, doctor, boosting immunity also helps children, right? I mean, to take precautions. This is one of the measures to take precautions and not to contact this COVID-19. So, could you just give some tips that parents can help the child to boost the immunity by intake of the food?
Yeah,
So,
regarding immunity, it depends on the age. So we can say like general rules for the immunity. Firstly, we need to stick to the vaccination schedule. Secondly, in the age of school or preschool, if we can go for some sport, because sport boosts the immunity. Thirdly, the healthy food, like they need to eat fruits and vegetables. This boost the immunity in very good way. And in the age of school as well, they can sleep at least 8 hours, and this will boost the
the
immunity.
immunity.
Yeah.
Thanks, doc. So, doctor, what are the main signs that the parents should look? Like children are going back to school now, and you can see the cases also rising.
Sure.
And it has been noted that since the school have started, then only the cases have risen. So it could be that I mean, children. It was also mandatory that the children has to take the test to go to school, and
Sure.
also maybe that's also the count. Maybe that the count is
Mhm.
risen. So I would like to know what the parents should look in the child if they have caught if they caught the virus, like because sometimes it can be
Yeah, sure,
asymptomatic, right?
sure.
So
The first sign is fever.
okay.
Okay, so any child suffering from fever, so parents shouldn't send him to the school. Okay, second sign is related to the respiratory systems, because corona is a virus that affects the respiratory system. So if there is cough with so fever with cough, or fever with shortness of breathing, or any problem in breathing, then we go to the doctor and we can make the test, or the doctor
Okay.
by examination he can see if we need to make the test or he have other opinion.
Okay. Doctor, we just received one question from Facebook. So they're asking, what should the kids do as soon as they reach home? Should they sanitize their bags, or is it only hands, or like?
uh, as much as we can, every bags come from outside, they put near to the door, okay, and not to send them to the apartment. And if you have spray with alcohol, we can like spray the bags, and sure,
Hmm.
once they go into the apartment, they go to wash their hands, okay, and for 20 seconds, and that's all what we can do.
Okay, so the kids must always sanitize their hands.
Yeah, sure.
Yeah, for
Yes.
sure. So, doctor, now after school, now kids are used to playing at home, and now school has started, so they want to go outside as well.
Mhm.
So after school, if they want to go outside, is it recommended that they go for outdoor games? Is it okay? Or
Uh, it depends on the place. If the place stick to the measures or the measurements that keep them safe, then there will be no problem. So if the place is wide and the place observes the social distance and check the temperature for the people who are getting inside, and if he takes the precautions, then there will be no problem.
yeah, because kids before they used to do this karate sessions, or all everything was online.
Uh-huh.
So now they want to go outside, right?
Yeah.
So, doctor, how do you recommend to manage kids with COVID anxiety? Like some kids, they have a lot of anxiety, and during COVID, and the parents tell them to wear the mask and do this thing, they are still don't know what to do. So, like, how do parents manage this kind of kids?
As we said, it's about talking. So we should keep in mind that it's very strange even for adults. Okay, it's
Hmm.
very anxious even for adults. Adults are very are afraid, and so we should keep in mind that even the little ones are, when we see all people in masks and all people talking about corona, sure they will be afraid. But all what we need is, we just need to talk to them, we need to support them, we need to talk about positive things, like sometimes it happen, we are waiting for vaccines, everything will be like before. So we need not all the time talk about negative things, we need
Correct. Need
talk
to
to
do.
no, talk about positive things, because God willing, inshallah, we will find vaccine and everything will be fine. So we talk to them about symptoms and precautions to take care, and at the same time, we need to talk about positive thing that will happen. We did these three things, like washing hands and keep the social distance and keep the mask on the face. This will be more than enough.
Okay, that's fine.
Mm.
So, so apart from like we mentioned that when the children sit in school in the class, they have like the separate cubicles, right?
Yeah.
So, doctor, is it, I meant to say, like before few months back, last year when the school was started, children used to interact with each other and
Yes.
they'll feel a lot of difference right now.
Mm-hmm.
So, how would it impact on their mental health, and how it will?
This need preparation. This is what we said before. We need parents to tell the kids what they will see when they go to the school. We
Okay.
need to prepare them, not to be shocked. Okay, we
Hmm.
need to prepare them, talk to them, tell them we will that when you go to the class, you will find that there will that the chairs will be apart from each other. This to protect you and protect your friends. We need to let them know, okay,
Correct.
not to go and find everything strange for them,
Yeah.
and that will help them to adapt, and later on they will go back to their normal life.
Normal,
Yeah.
inshallah, soon. Doctor, regarding, I know I've asked you a question that someone had asked me how to boost the immunity system in the children.
Mhm.
Is there any like top three meals that you recommend to give to the children that they can boost their immunity?
uh, if I can not top if I can say only one meal, not top three, fruits.
Okay,
Just
that's
give them fruits as much as you can, and if we need also omega-3, it will be in salmon and seafoods and something like that. So this is the most important. But fruits and vegetables, because sometimes kids don't like vegetables like fruits, but if we can give the kids fruits, it contains too much of vitamins.
thank you, Doc. So, Doctor, I think that was the last question.
Mhm.
So we can conclude. Thank you, Doctor, for your time.
Thank you, Dean.
And
Uh, Thank you, everyone. I was so happy to be with you today. I'd like to remind you with myself, I'm Dr. Michael Atiyah. I'm working in Medcare Rashidiyah Clinic. If anyone need any help, he can contact me. And thank you one more time.